Calls for a Medicare for All system are growing louder. Many Democrats have embraced it, while President Trump has said in recent weeks or months that it would raise healthcare costs drastically. Democrats say that giving people the option to partake in Medicare, no matter their age, will actually cut costs. American administrative costs for healthcare are the highest in the world, and supporters argued that one advantage of Medicare for All is that it would save money because Medicare's administrative costs are below those of private insurers. Does that argument hold up? That's the topic of this week's Healthcare Triage. Medicare's administrative costs were $8.1 billion last year, or 1.1% of total spending, close to the proportion it has been in recent years. But some have argued that the actual cost is higher because of services performed for Medicare by other parts of the government that aren't accounted for. The Social Security Administration collects premiums, the Internal Revenue Service collects taxes for the programs, and the FBI provides fraud protection services. And at least 7 other federal agencies and departments also do work that benefits Medicare. The claim that these administrative costs are overlooked is false. As annual reporting of Medicare's finances plainly states, they are accounted for. But there is something missing from the $8.1 billion Medicare administrative cost figure, as Kip Sullivan explains in a 2013 paper published in the Journal of Health Policy, Politics, and Law. Although it accurately accounts for the federal government's administrative costs, it does not include those borne by private plans that also offer Medicare benefits. You gotta remember that in addition to the traditional public Medicare plan, Medicare is also available from private plans through the Medicare Advantage program. Today, 1/3 of people using Medicare are in such plans, up from about 1/5 a decade ago. Moreover, all Medicare drug benefits are administered through private plans. National health expenditure data shows both the government's administrative costs for Medicare and those of Medicare's private plans. Putting them together for the most recent year available, 2016, they reach $47 billion, or 7% of total Medicare spending, well above the administrative costs borne directly by the Medicare program. Medicare's private drug benefit plans incur administrative costs that are about 11% of their spending. All of this additional private administrative cost is paid for by taxpayers and through their premiums, people who use Medicare. Medicare's direct administrative costs are not only low, but they also have been falling over the years as a percent of total program spending. Yet the program's total administrative costs, including those of private plans, have been rising. Making an accurate estimate of the administrative costs of Medicare for All would depend in part on whether it would be more like an expansion of traditional Medicare, with its 1.1% administrative cost rate, or of all of Medicare, including its private plans, with a combined 7% administrative cost rate. Yet both figures are well below private insurers' administrative costs, which run about 13% of spending. This also includes profit, of course, according to America's Health Insurance Plans, an advocacy organization for the industry. Some critics have argued that Medicare's administrative cost rate appears artificially low because Medicare's enrollees' health spending is so high. Average Medicare spending per beneficiary is just over $12,000 per year. For an average worker in a private plan, it's about $6,000. If you simply divide administrative costs by total spending, you will get a lower number for Medicare for this reason alone. This is true, but the government's administrative costs for Medicare are still below those of private plans when we look at other metrics. The government's administrative costs are about $132 per person, compared with over $700 for private plans. One reason Medicare's are so much lower is that it reaps economies of scale. It also benefits from not needing to do much marketing, and it doesn't earn profits. A final critique of Medicare's administrative costs is that they're inefficiently low because the program doesn't spend enough on anti-fraud efforts. This is hard to prove or disprove. The government engages in a number of Medicare anti-fraud activities that more than pay for themselves. Perhaps another dollar spent tracking fraud would yield more than $1 in return. Still, even if Medicare did every bit as much in this area as the private sector, it would not raise its administrative costs by much. The efforts to prevent waste, fraud, and abuse are very low in private plans. Although Medicare for All might shed some administrative costs, it could also shed some other features, including some that many people appreciate. Traditionally, Medicare is primarily focused on processing payments to providers, while private plans, including those offered by Medicare Advantage, employers, and Affordable Care Act marketplace plans, engage in care management, which could help coordinate care for people with chronic conditions. Private plans also establish networks of physicians, which could help steer enrollees to higher quality providers. These activities cost money and are things traditional Medicare doesn't do, at least not directly. It has, however, put in new programs to give healthcare providers incentives to better coordinate care. Another point in favor of private plans is that they're more responsive to consumer demand. For this reason, private plans have provided some benefits that Medicare hasn't, or provided them long before Medicare did. For example, drug coverage was commonplace in private plans well before Medicare put in a universal prescription drug benefit in 2006. Another is that traditional Medicare still doesn't have an out-of-pocket limit, whereas that's standard for private plans. But let's get back to the main question we posed at the top. Are Democrats right that Medicare's administrative costs are below those of private insurers? The answer is yes, but that's in part because private plans do things Medicare doesn't. Whether those things are worth higher administrative costs is a value judgment on which reasonable people can disagree. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Hey, do you like the show? It really helps if you like it or subscribe right down there. And another good way to support the show is a subscription service called patreon.com, which allows you, the viewer, to support the show. Even like $1 a month helps make the show bigger and better. And if you want to do more, that'd be great too. It'll always be free, but everything helps. We especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course, our Surgeon Admiral Sam. And while I've got you, I really want to plug the Healthcare Triage podcast, which is now pretty regular and doing great. You can get it wherever you get your podcasts, Spotify or iTunes or wherever. Of course, HECmerch.com, great place to pick up merch. And of course, my book, The Bad Food Bible, still on sale in stores. And it's patreon.com/healthcaretriage.